Welcome. Welcome to our February monthly training. For today's meeting, we will be going over this month's training as well as provide additional information for what will be taking place during this month. If you have any questions throughout today's meeting, please feel free to send them in the chat. For today, we will have everyone keep their microphones muted. If you can please turn on your camera so we can see your beautiful faces and smiles, that would be great. Our session will be recorded for the rest of the meeting, and our meeting will take place today, and we will be sharing all of the information, and all of the information today will be provided in English. Just a brief overview of our agenda today. We'll be having our welcome, with a short recap of last month's meeting. After our welcome, we will dive into small breakout rooms with a small group. Once that is completed, we will go ahead and learn all about what the February month will look like. This month's theme, as you can see, is on planning and preparation. Planning and preparation will consist of planning your campaign. We will go in depth in today's slides about what this will look like when talking about effective messaging, creating an action plan, COVID-19 information, as well as submitting products for approval. Once that is finalized, we will go into small groups. And additionally, we will have a time to share next steps and updates for all teams with a closing reflection at the end. For January's monthly training, we talked about a few different things. Some of the topics mentioned when we met last month were the topics of our service learning iPart cycle. For those of you that don't remember what the iPart cycle was, we will be talking about that shortly in the next few slides here. With our iPart cycle, we touched on investigation, which is the I in iPart, and that I or investigation is what we did throughout the month of January. We did our investigation process.
Students that we're interviewing, and it's been very interesting hearing their observations, because this specific group, a lot of them are unaccompanied minors, and some of them have a lot of difficulties that maybe they didn't really imagine until they started interviewing them and hearing about their lives. So for me, it's been really meaningful and very interesting. But if you want to hear more, I'd rather the students talked about it.
Can you ask one of your students to unmute?
Jalen, are you ready?
Sure. So we used focus groups as a way to interview our classmates. And I think one of the barriers that we faced was them kind of closing off on us and not being able to fully express themselves and about like COVID resources and many other things. I think that was just the biggest challenge that we faced. But I think over time, once we got to get to know them better, it was easier for them to sort of talk about more difficult stuff. And yeah, I don't know if anyone else wants to share from our group, but
you know, I wanted to add, when we met as a group to talk about it, because they interviewed their peers, we probably would have done better if we'd done some like get to know you games or icebreakers to start it off. You know, it's very different when an adult interviews you or adult to adult, and I just didn't think of that. So next time, that's what we would do. Osvaldo, you want to add anything?
Sure. What Jalen was saying, we did focus group. It was fun to interact with other students and like interviewing them, and like what Dr. Dinah said, that it's kind of awkward having an adult just like interviewing like students, youth, teenagers, right? And I feel like that students to students are more, how would you say it, more helpful, more to get like answers out of others instead of like adults. Sorry.
No, I think you make a really good point. Sometimes it's easier for young people to talk to other young people. And that's why we're so excited, Osvaldo and Jalen, that you are here, because you're the messengers, right? You're the ones that will be able to get these messages out to your peers. Thank you so much. Anyone else want to unmute and make some comments? Jayshree said that she used the survey method and the common answer was unemployment and not enough information. So that's really interesting, isn't it? So that can help inform your message product. Lee talks about he's been doing some surveys, revealed that half trust the vaccine and half don't and will never get it. So one of the comments made was that schools with students who have gotten the vaccine has more COVID cases in schools with a lower vaccine rate. Now that's interesting. That's very, very interesting. Any other thoughts? I think what we'll do is hop on to our PowerPoint. So Lizzie, if you can start sharing the PowerPoint here. And we're going to dive into some of the guts of what we're trying to get across to you so it's easier. And I really, Andrea, thank you, Dr. Dinan. I really appreciate your comment, because that's really important to know. Should we be doing this next year? Hopefully we're out of this pandemic, right? But if we are continuing, if this is a need to do, that's an important aspect for us to include. Thank you. There we go. And also just a reminder, in the chat, there is a link where you can sign in. Again, thank you for those of you who have been able to get the CIP completed and shot to us. If you're having some issues or problems, hang on to this call or stay on afterwards, and we'll answer if you have some specific questions. So today, as we mentioned, we're really going to talk about planning and preparing. Next slide, please, Lizzie. We're going to talk about planning and preparing. And as you can see in that diagram, it's part of service learning. It's part of the student experience. You now did that investigation, and maybe you're continuing to do some investigation, but that is going to help you make the best use that will inform your messaging product. I use the example sometimes of doing a project without getting the information first, like young people tying blankets for a homeless shelter, and they deliver it to the homeless shelter and it was the wrong size. So you want this message product to reach the audience that you are intending, and you also want it to say words and say things in a way that is understood. Next slide, please. And I think this is just a placeholder to talk a little bit about. Today we're going to talk about planning your campaign. And what that means is talking about your data and your analysis. We're going to be talking about creating an effective message. And we're also going to be talking about designing an action plan, so it helps you best use your time. All right, so next slide, please, Lizzie. Next one. I'm going to talk first about effective messaging. So the first step when you're putting together some kind of a messaging product is really start with the analysis from your CIP, from your community inquiry process. And I think we were getting some bits and pieces from you in the chat. There was some data that said the people who were vaccinated in one school had a higher rate of COVID. I'd want to dig deeper into that and kind of see and kind of tether that out, kind of like a fishing knot. How do you untangle that? So look at that information and what is it that people need to hear? What is the message that you're wanting to send? That really leads into that second bullet point, which is really what is the objective of your message plan. And I think some of you mentioned it in your CIP form that you handed in just this last week. I think some of you talked about masks, the importance of masks. And masks is the topic, but the objective is a little bit more specific. The objective is using masks to prevent getting COVID, or vaccines is the topic, but say some more about that in determining your objective. You will have another form that will help guide you through this process, and Lizzie will be talking to you a little bit about that after we get through some of this data. So consider, after you take your research and your the information from your first step, think about what is the meaning, what's the purpose of this message. It's always important to start with that. And then the next bullet point is really talking about considering your audience. If your audience is young people, that's a different messaging product maybe, but it also might be a different message and how you say things. Tailor your language to your audience. One of the helpful hints that we received from Proceed was that oftentimes numbers can be a little overwhelming or not, maybe not as easy to understand. It's a difference between saying something like, well, 98% of people prefer chocolate, as opposed to most people prefer chocolate. So consider changing data, the bits and pieces of number, consider making it a little bit broader. Another helpful hint they shared was focus on what you want people to do rather than focusing on what you don't want people to do. For instance, join today instead of, if you don't join, this is what's going to happen, or get vaccinated at your local community health clinic, rather than, if you don't get vaccinated, da, 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 da. Have it be a positive act. That's how asking people to take action. Next slide, please. Then your next task is really, and we'll give you information, and we'll give you the slide deck so you don't have to write everything down, but how are you going to say it? We just talked a little bit about that. And where are you going to get the information? Now, we'll be providing you with some links of accurate information. There's a lot of misinformation out there, and we want to make sure that we give you the kind of information that is easy to get to people, so it's in people's hands, in their eyes, and in their ears, right? So we'll be giving you some trusted places to get that information to help craft your message. We're asking you our next step is really filling out this product form, you know, what's your script or what's the copy. We'd like you to just submit that in English, but your messaging product will also be in Spanish. It will be in Spanish because we are targeting a Latinx population. Next slide, please. Now, one of the things that was important, and I dug into this a little bit last night because I found it really interesting, is in these messaging products, you want to include a call to action. A call to action is an invitation, or you're asking people to do something. You're asking them to take a desired action. And some of the guidelines or some of the tips that I was reading about is, you know, create a sense of urgency. And the example they used in this article I was reading is download this now. So you're creating a sense of do it right now. Don't wait, do it right now. So include some sense of urgency in your call to action, in your messaging product. Another helpful hint is use strong action words like donate or show up or join us. So an action word with that same sense of urgency. So a verb, tapping into some of our English learning. Another tip was take advantage of the fear of missing out, FOMO, fear of missing out. Shop today, the sale ends on Monday, so hurry up. Don't forget to do this. That gives us people a sense of, oh, I better do it and take action right now. I know if I say to myself, well, I'm going to go visit that website a little bit later, I'll remember it. If I don't go do it right now, it's gone. You know, all of us have lots of things going on in our lives. If you don't do it now or create that sense of urgency, here, this visual in the corner is an example of a messaging product that has a call to action. Wear your mask so our businesses stays open. That is a call to action, and that is creating a sense of urgency. It's a strong action word, wear your mask. And it also gives that sense of, if you don't do it, this is what could happen without saying it. They're saying, you know, this way our business gets to stay open. Next slide, please. And you can click, perfect. Nope. So here are another set of examples. One other tip says provide emotion, or so provide some sense of emotion that people are going to feel strongly about it. I'm reading my slide and it's really hard to on my small little computer. So hang on a second. So emotion or enthusiasm. Find your dream home with us. If you're selling a product, find your dream home with us. That's tapping into emotion and feelings. That's a really powerful way to tap into people's emotions. Make a promise. Lose weight in 6 weeks. Boy, that was really popular at about January 1st. The people who were advertising their weight loss products, lose weight in 6 weeks. People are going, okay, they're counting down the numbers, and they want to be a part of it because there's a sense of urgency and there's a little bit of a promise. Next slide, please, Lizzie. So how are you going to share the message? These are some of the ways that you can create, that you can, the messaging products. These are some of the kinds of messaging products you can have. You can have a social media campaign, an infographic, and there are strategies online on how to create an infographic. You could do a poster or a flyer. Now, again, remember that you create a product, but that's not the campaign. The campaign contains all of these sort of things. You're creating, you're planning and preparing. You also have to make a plan for how you're going to distill it, how you're going to get that message out. That's going to come a little bit later. You could do a billboard, and that could mean a sign in a schoolyard, a toolkit, some resources for people to use to gain information that gives them a better sense of what they need to do. A fact sheet, a PSA. We're going to show you a couple of clips of different messaging products. A funny video, a TikTok, a coloring book, or a magazine. If your audience is young people, I mean the littles, a coloring book could be a really fun and engaging way to reach that audience. It actually might even be coloring books are quite the rage right now. Funny memes. Use your creativity in finding a message that tells others what you want them to know. Next slide, please. Right now, we are going to talk a little bit about, we're going to ask Lizzie to share a different screen. These are some examples of messaging products. Now, they're not the same issue, and one of them is, but there are different ways that you can approach. And I thought it would be useful to just look at some fun ideas of how other people are getting a message out.
Okay, they should be ready in just a moment.
Thank you for helping me manage this, Lizzie. It's always so helpful to have somebody who can run the tech so I can just focus on what I'm trying to say.
In the meantime, while I get that pulled up, I would just like to ask a question. Does anyone have any examples of any message products or any videos they've seen, in this case, where they've seen some type of message being shared, whether it was a video, a picture, or a meme? While we get that link posted and shared up here, does anyone have anything they'd like to share?
At the push of
You know, I can pull up my slide or my screen right now, if that works for you.
That would actually be great. It's just with the registration notifications that I was getting
There's this
throughout the
wonderful, this
meeting.
is a, let's see if you, can you see that? Give me a thumbs up if you see it. This is a ad about mental health. So take a look. It's a PSA or it's a commercial. So listen to this.
Fortunately, people always have a lot of ideas how to help you through. You just gotta snap out of it. You have so much to be happy for. Fake it till it feels normal.
Cheer up.
It's all in your head.
It's because you're a Leo. Think about all the people that have it worse than you.
Depression can
While that is a video of, well, that is a video that's an ad, it is a powerful way to send a message about depression. Is that useful? Is that helpful? I'm going to share another really quick, see if I can find it. Yes, I can. This is a quick little snapshot of, oh, there we go.
He always shuffle his own snow. Hey, got to. You know that? You gotta do the things that makes you realize what everyday New Yorkers do. I'm a 5-borough mayor doing the 5-borough things of everyday New Yorkers. You always
So those are two really quick, simple examples of just let your mind think about can you use that as a strategy? And these do not have to be slick professional, but it has to get their message across. And I think we're going to go on to the PowerPoint right now, please. I am. Thank you, Lizzie. So we'll go to the next slide. So we just want to talk a little bit about your action plan. So now you've talked about your message. We've talked about your message. You've created your message. You've considered your audience. You've got really good COVID information. And Lizzie's going to share with you a little bit later how to access some really good COVID information. We talked about your call to action. We looked at a couple of examples. Now we want to talk a little bit about an action plan. And this is really about making sure that you involve young people in your process. So start with some of your goals. You may have used working with SMART goals with young people. SMART goals stand for specific, measurable, actionable, it can happen in it's realistic. It can happen in a specific time. It's a realistic goal and timely. That's an idea, but please consider sketching out some steps in order to help you create your messaging product. Make sure that everybody has a role. This is a youth involved, youth led, youth engaged action. So make sure that people have a role. And then when you're thinking about creating a timeline, we find that's helpful. I like to think about what is due at the end and kind of work backwards. So looking ahead, think about wanting to make sure this is done in March, April, May. Your February task is really to create that message product. And then we'll be talking about what the next steps are after that. But thinking about when you're going to launch this, it's March, April, May. So remember that there needs to be a little bit of time in your timeline reserved for checking with the CDC that it aligns with the current and accurate information. And let's face it, who knows what could happen in 3 weeks? I'm thinking about Omicron, how that really rose up and showed itself. And we had to make some adjustments in our data. So, and also please remember that we are going to pilot these. So think about once your product is done, once your product is reviewed and you're ready to go, then we're going to be piloting this. You are going to be piloting this message. That might be, and we'll talk a little bit more about that as we get, but it will be part of the next steps in terms of reaching your audience. And then reserve some time for planning your National Service Learning Conference video. And Pam will talk a little bit more about that. So we're throwing lots of information at you, but what we want you to do is really consider having a plan that is doable, that everybody has a role, and that you're thinking about these big chunks of time. Next slide, please. So what is your budget going to look like? You all are receiving, if you've filled out your grant and have returned a W-9, you will be receiving a grant from NYLC. So we encourage you to think about how you're going to spend your money for this project. Next slide, please. So here are some of the ways that you can spend your money. And I've got this really small printing here, so bear with me. Because it's a federal grant, because we're running this money, we get a federal grant and then we release the funds to you. Because it's a federal grant, these funds cannot be used for lobbying, but they can be used for video editing software. It can be used to buy those poster boards and markers, props for your videos, for printing, giveaways, transportation, gift cards, for incentives or thank you gifts, childcare, substitute costs, meeting expenses, such as refreshments or pizza, or other fees and supplies. So this gives you a sense of some of the ways that you can spend those funds. So my next thought really is, before we go on a very short break, is thinking about who you're going to pilot this with. So be thinking about who you want to pilot your messaging product with. And we'll be talking about the product information form, otherwise known as PIF, P-I-F. And you'll be going through that with Lizzie a little bit later. So at this point, I'd like to ask if there are any questions that we can answer before we go on a short break.
I was asking if is it good to get the vaccine?
Is it good to get the vaccine? I would say that the health information, the information that we have right now from health officials, really encourage people to get the vaccine. And I heard this morning or this afternoon that they were now announcing that they're hoping to get the little ones, the 6-month-old to the 5-year-olds vaccinated. So our health officials are telling us that that is the best, that's the way to be the safest in regards to COVID-19.
Okay, thank you so much.
You're welcome. And Carlos, when you're creating your messaging product, I want you to make sure to go onto one of the websites that we give you to get some good information. So you have data and it's not just somebody's opinion, because nobody's going to listen to Julie who's talking about it. I mean, maybe some of you would, and my children will, and my friends and family, but make sure that you look at the data and the medical science to really show that you have the medical stamp of approval. Any other thoughts or questions? Well, I'm going to turn off my screen, and when it comes back in 4 minutes, my clock says 6:15, so at 6:19 we're going to come back, and Carmen is going to take us through a little bit of a song and dance. No, not a song and dance, but just some kind of an activity to get us all back together. So when you see my screen come on, when you see my face and Lizzie's face come on, please join us back, but take 4 minutes and go get yourself something to drink or stretch your legs, and we'll see you in a few minutes.
Bye. Huh?
All right, I've given you 4 minutes, not much time. You can't have a whole meal, but you can certainly have gotten a glass of cold water, or maybe just stretched your legs a little bit. So I'm inviting you all back to come and listen to Carmen. Carmen's going to give us a little energizer here, lead us in something. And then we'll be hearing more information from Lizzie about COVID, some of the information that she's gotten from the CDC and PROCEED that will really help guide how you create your message product. Take it away, Carmen.
Yeah, okay, I'm gonna assume you're all there, really excited. Even though I see none of you, it's a choice you all made, it's fine. We're gonna play Simon Says, and I'm just gonna assume we're playing along. It'll be like a little mind game. So we all know how Simon, wait, okay, yeah, we all know how Simon Says works, yeah? Like thumbs up, Julie knows, that's cool, okay, that's all we need. Okay, Stephanie knows how to play. Angel knows. Okay, good. This is good looks, guys. Glad you know. So we're just gonna go. Oh, good. I can see 2 people now. So Simon Says, touch your head. Excellent, beautiful. Everyone else, assuming you're touching your head. Simon Says, turn off your video. Simon Says, turn your video back on. And turn on even if you didn't have it on before. Simon Says, clap 4 times. And then clap 3 more times. Wow, bad vibes, guys. That was too easy. Oh, that was funny, Hensley. Okay, Simon Says, touch your head again. Simon Says, clap your hand. Simon Says, touch your shoulders. And then switch your arms. Oh, guys, it's too easy. Okay, Simon Says, turn your video back off. Simon Says, go for a run around the park. If you could do like a 4-minute mile, that'd be really cool. Okay, Simon Says, turn your video back on. And everyone clap 4 times. Okay, you guys are getting good at this. I was impressed. Okay, that was it. We'll play again. It didn't work perfectly, but it was epic.
Thank you, Carmen. Thank you so much, Carmen. We are now, now that you've had a little bit of movement, I know that many of you spend all day, there's a cat, I love it. Many of you spend all day either on a screen or in front of people or studying at your desk. So we wanted to just give you a chance to move around a little bit. I'm now going to invite Lizzie to come and share with you some of the information that she's been gathering in her work around for this project. I'm going to share my screen now. Get the right slide. There we go. Thank you so much, Lizzie. Take it away.
Perfect. Thank you, Julie. So how many of you here, I don't think I see anyone else, but how many of you here can see that I am wearing a mask on a Zoom call? All right, so you might think,
excuse me?
Yes, yes, April? All right, well, if they do jump back on, we'll go ahead and answer any questions. And as we go throughout today's training, if any of you have any questions, feel free to send them in the chat. Myself and my colleagues, Julie, Pam, as well as Carmen, are available to help answer any questions. Let's go ahead and move on to the next slide, please, Julie. Thank you. All right, so this portion of the training is going to be very, very interactive. So I'm going to need all of you guys to help out, whether that's sending stuff in the chat or unmuting your mic. This is going to be a portion where, as you all know, we've all heard things around COVID-19, but this is going to be a time for me to hear about what you guys know, and I'm going to specifically ask a question. If you all could answer it, or whoever wants to go first, go ahead and jump in. So an introduction to COVID-19 awareness and prevention will be provided in the next few slides. To start off, I would like to ask, what are some myths around or about COVID-19 that you've heard about? And in this time, as I mentioned earlier, I will have you guys all provide details, or in this case, share any myths that you've heard around COVID-19, and we'll have you guys enter those in the chat, or you can also go ahead and unmute yourself, and I will be placing everyone's answers here in our white box. So if anyone wants to start off, we would love to hear any myths you've heard around COVID-19.
I have a question.
Yes, Sarah, how can I help you?
Is this from like just our personal experience or from the like interviews or focus groups or surveys we conducted?
Great question. So this can actually be in relation to anything. So if you've heard myths around, whether that's your friends, social media, or even in the research you've done, you know, that would be a great place to enter in, or to provide any myths that maybe others have heard about as well. So it can be in relation to really just any broad topic. And it looks like in the chat, I see a few people mentioning, I've heard some people don't want to put chemicals in their body. That's a good myth. Another one is tracking device in the vaccine, microchips in the vaccines. Amanda said a myth I've heard is that the number of people who have died with COVID is much less in reality. Jalen, I like what you said there. You can protect yourself from COVID-19 by injecting, swallowing, bathing, or rubbing into our body, bleach, disinfectants, or rubbing alcohols. And I think this myth itself can be something that maybe we've heard about, whether that's online or even just from the people we know around us.
Some people,
would anyone, sorry, go ahead.
Sorry, thank you. Some people consider that this is a kind of sterilization process, unfortunately.
That's a good observation, Maida. Anyone else have any other myths that they've heard? We'll just go for another 2 more minutes, if not a minute to 2 minutes, just so we can keep having you guys participate. So I'd love to know any myths you've heard about, or that you might know about that someone else has told you. Someone else added in our chat. Let's see. So they said, from Jalen, the COVID-19 vaccine is unsafe because it was so quickly developed. That's a good myth as well. And then we see sneeze or cough may be some symptoms of vaccine. COVID-19 is related to 5G, so vaccine won't help. And that one is from Lee. Lee, that's a great myth, because as we all know, a lot of the times we'll hear things related to things around, in this case, the 5G or the metaverse, and you'll hear other conversations around that are not correct. And also Angel did say, I heard that the vaccine is not 100% safe. That's why they make you sign papers at the beginning. I will go ahead and give just one more person a chance to share any myths that they've heard about around COVID-19, and then we will move on from there. Let's see, it looks like Luis Jimenez said, I need to leave, and that's totally fine, Luis. You can go ahead and do that. Why don't we move on to our next portion of our PowerPoint here. As you guys have shared different myths, I have loved hearing everything you mentioned. Christopher also said the denial of the existence of COVID. So this one here is very true. Many times people might say, well, COVID or this pandemic is not real, or in other words, it might just be hard for them to believe what's going on around us. So let's go ahead and now that you guys have jumped into providing some information in terms of myths that you've heard around COVID-19, we have some information to share with you guys about the national data that I personally did receive from our trainings directly through the CDC, and this is in correlation to the Latino community specifically. So there are about 24.2% of all cases of COVID-19 specifically in Latinos. What this means is out of all the Latino or Latinx identifying folks in the United States, we have seen a total of 24.2% with confirmed positive cases. Of the population here in the United States, 18.5% of this population is made up of the Latino or the Latinx community. And from what we know, there has been a 17% percentage of all deaths from COVID-19, or 17% COVID-19 cases and deaths that have been, in this case, reported have been in the Latino community as well. We can go ahead and hop on to the next slide. Thank you, Julie. All right, so here I'm going to ask you guys, what is COVID-19? I know you have all mentioned it is a, whether someone said there's vaccines, or in this case, there could be chips in the vaccines. We've heard myths, we've heard things or ideas or even beliefs around what COVID-19 might be. But at this time, I would like to ask if we can have one person jump in and participate. I would greatly appreciate that. What is COVID-19, or what do you know about this virus? And anyone can go ahead and jump in here if you'd like to unmute your mic or send something in the chat. That would be great. And it looks like Victor says in the chat, COVID-19 is a type of virus that has spread all over the world. That's very, very good to know, Victor. Thank you for sharing that. So we'll go ahead and jump back in. So what is COVID-19? As many of you know, we have been going about this pandemic for a while now, and we've heard this term, COVID-19. We've heard all about this COVID virus. So really, just touching base here, what is COVID, or what is the virus itself? So we know from the findings that we've collected through the CDC and through major health organizations, we know that this virus is a type of coronavirus. So as we know, COVID-19 isn't the only type of coronavirus that has existed. There have been various types of coronaviruses that have developed throughout the years, but with specifically COVID or COVID-19, this is a SARS-2 COVID virus that originated from Wuhan, China. I know as we look back on the time frame of things, Wuhan, China, or in this case, China was the location or the destination as to where the COVID-19 specifically originated. And as we know, we are currently in a pandemic specifically because of this COVID virus. So that's just a little bit of some background. Some more things that you should know about the COVID-19 virus is that there have been various variants that have developed throughout the time since we first saw the first confirmed case. So as we know, there has been the Alpha variant. There are a total of these 6 variants here. So there's the Alpha, the Beta, the Gamma, the Delta, and the Omicron. From all of these so far, we've had a confirmation of various ones, Omicron being the most recent one. And I'm sure most of you here have heard about Omicron or have known someone that might have gotten sick with it. But that variant specifically, the Omicron COVID-19 variant, is the most recent one as of today that has been confirmed. And we can go ahead and move on to the next portion of the slides. Okay, so in this portion here, I would like to ask you guys all another question. And if anyone could please unmute their mic, share it in the chat, whatever you feel most comfortable with doing, that would be great. What is, in this case, a way of this virus spreading, or how is this virus spreading throughout our community, whether it's your schools, your families, your friends? How have you known, or what have you known of this being the cause of spread? Does anyone have any examples? And it looks like Luis said, my brother told me that it gives some cancer. Anyone else would like to share how this virus might spread amongst our communities, or amongst any of our people close to us? So someone, Amanda, responded through parties. Victor said the virus might have spread from person to person. All right, well, thank you, Amanda and Victor, for your interaction. So I will jump back in. So the transmission in this case, as we know, COVID-19 is a respiratory virus, or it is a virus that is easily spread. The transmission in terms of how it is transmitted, COVID-19 is transmitted mainly from person to person. So Victor, you are correct. And this happens, as we know, through close contact, specifically from anything between 6 feet or less. So as we all know, if you are at a coffee shop, let's say, and you are standing in line to buy your drink, most of the time you aren't standing that full 6 feet apart from the person in front of you. So with COVID-19, the transmission, or in this case, social distancing, has been moved or agreed upon to be approximately 6 feet or 2 arms width away from someone else. With this distance, you are able to stay away from the other person and not be as close if they are a person that might be confirmed a positive, or in other words, as Victor mentioned, it's mainly passed from person to person, but it is more known to have been spread for anyone that is 6 feet, between 6 feet or less from the distance they are to the person next to them. So we can go ahead and jump on to the next slide. Okay, why don't we can jump forward 2 slides. We'll jump back to the resources in just a moment. So if we can go forward just 2 more times, that would be great. 1 more. Okay. My apologies. It looks like the slide was not incorporated into that portion of the presentation, but I do have it here for my reference. So I will go ahead and continue on mentioning a little bit more about the COVID background and information. So as we talked about, what is COVID and how is it easily spread? As mentioned, COVID is transmitted mainly from person to person, specifically from those that are in close contact of less than 6 feet or more away. Another way that this virus is transmitted amongst individuals is through the touching of a surface or object that has the virus, and whether that's, you touch something such as a computer or a table or something that has already been impacted by the virus itself, and then going about and touching your mouth, your face, your eyes. That's another way that this virus itself can be transmitted. Another thing that we have found was that through the respiratory droplets that a person that's infected has, whether they sneeze, cough, or talk, this is a way of this virus being transmissible amongst the people around, or in this case, some of the droplets or particles in that person's cough or sneeze might remain in the air, or in this case, those droplets and particles in the air can remain suspended. And then this air can be breathed by others, causing for someone else, let's say you are on a bus, they sneeze, they cough, and if you are not too far from them, it easily can be passed on to you through, in this case, coming into contact with those droplets of their sneezing or coughing, or even simply through their talking. Another thing I do want to mention is with the COVID-19 transmission, it is very likely to happen in closer combined communities, or as other people know, where there isn't social distancing taking place. Now I would like to ask you guys some questions in regards to the COVID-19's symptoms. Would anyone have any idea, or has anyone had any symptoms related to COVID-19 that they can please share with the group? And I'll give you guys a minute or two if anyone would like to jump in. Amanda, thank you for your participation. She said loss of smell or taste is the main one. That's a good example. Has anyone else heard about or know of any symptoms that might occur in relation to this COVID-19 virus? Fever or chills, cough, shortness of breath, or difficulty breathing, coughing and sneezing. Damaris, that is, those two examples that you provided are very, very true. There's also dry throat. Someone said body ache, shortness of breath, runny nose, difficulty breathing, feeling nauseous, and headache. All right, well, all of these are great examples as to what you guys have heard about or know of the COVID-19 symptoms being. Some symptoms that I will provide for you guys. And again, all of the information we are providing through today's training will be shared to you guys in a later email. So you will have access to this information later on. So COVID-19 symptoms can be different for certain people. So symptoms can vary in severity and appear between 2 to 14 days after being exposed to the virus that causes COVID-19. What this means then, if you have started experiencing symptoms, it's not until day 2 or 3 that you will realize or notice that something is wrong, or you might notice you're not feeling too well. And a way that these symptoms can show up, or how you might be feeling, can appear in the following ways. You can be dealing with difficulty breathing, as someone mentioned in the chat. There's also shaking or chills that take place within your body. You do feel fatigued. Muscle and body aches are another sample of this. Headaches, recent loss of taste or smell, and stuffy or runny nose, as well as diarrhea. So with these symptoms, all these symptoms can vary, as mentioned, from person to person. So if a patient or if an individual isn't feeling well and they have a headache and they have a runny nose, sometimes it's best to make sure you know who you've been in contact with, because a lot of these symptoms, as mentioned, they can show up highly on day 2 to 3, which is always going to be when you should make sure, if you start developing new ones, if you have a headaches or if you develop muscle and body aches after that 2nd or 3rd day, make sure you are keeping yourself safe and monitoring really how you are feeling after you start getting sick. So moving forward to the next question, how can you help prevent the spread of COVID-19? Does anyone have any idea of how you can help prevent the spread of COVID-19 amongst yourselves or your community? Let's see, Victor said wearing a mask. That's a great example, Victor. Social distance. All right. So those are all great topics that you guys have touched on. Moving forward, we will go ahead and mention just a few ways that you are able to prevent the spread of COVID-19 through vaccination, washing your hands, wearing a mask, just as I've worn one today, as well as social distancing. And social distancing, I'm sure most of you have heard about the term, but this is when you are maintaining that 6 feet or more, or about a 2 arms length apart from the person next to you. And the next slides on this presentation provide some additional resources where you can access COVID-19 tests from home, some additional information about vaccination, but we will provide these for you in a handout after the presentation today. So let's go ahead and jump on to the next slide. All right, so now that you guys have heard all about what you'll be doing with, in this case, the message products, as Julie touched on. Julie, you did a great job at explaining how we can best do this. You will be given, as she mentioned earlier, a form that is going to help walk you through, now that you know that you'll be creating a message product. Now that you also have a little bit of background of what COVID is or some more information into it, you will all be provided a message product information form. This is a short way of knowing the product information form. Title can be simply stated as the PIF form. So this form is going to be completed by all team members, and it's going to give you a guideline, as well as, in other words, a resource to help you fill out your step-by-step. So you are going to complete this form that will then be submitted to our partner organization through PODER and SALUD, which is Proceed. They on their end will be receiving the forms and they will move forward with the message products after they've approved them. So an example here, as you can see on the screen, this is what a product information form might look like for you guys. So an example here that was filled out, the date was December 8th. My apologies, that was a bit hard to view there. The name of the person submitting the form in this example was Brenda Cruz Scotton, who she, in developing her message product, they titled it Teenage Dreams. Another way, or another person that will also fill out this form is going to be someone alongside. So both, it could be another adults or a youth leader. As you guys can see on this sample form, we have the manager of Proceed, who was in this case a person submitting it. So if you guys have someone else jump on in or help with creating this form, we will have to place their names in who is submitting it alongside with you. With the form itself, we have different submissions that will take place throughout this process. So in this case, you guys can move forward on the form under where it says intended Latino audience or group. Brenda Cruz Cotton, as well as Stephanie, those that filled out the sample form. And one way that they titled the type of community or the type of message product they're working towards is, they said Latino families in Union and Essex County in New Jersey. So if this is your high school, if this is your organization or nonprofit organization that you're working with, this is where you would fill that out. And below that portion, if Julie could just point out under where it says type of message products, please select one. This is just going to be the option or the portion where you select which type of message product you are creating, whether that's a social media campaign, an infographic, a brochure. An example that they shared here was a PSA or a public service announcement. This is where you are going to select the type of message product that you will be submitting for us to review to then have approved for your PODER and SALUD program. And that is a little bit of a breakdown of the form itself. So you guys all will be receiving a copy of that after today's training. And it looks like one last thing just to go over some few details. So here with the description of the type of document, or my apologies, with the description of the type of PSA or message product that Brenda and Stephanie put together. So an example here is they described what they're doing. So they said the scene will show a teenage boy between the age of 16 to 18 at home in his living room texting with a friend. So as mentioned, their message product that they created or that they've put together was a public service announcement. With this, the friend will then ask to see him later at a party. Throughout the message product, they're going to show text messages from the phone that will appear on the screen as bubbles. So just going forward, the gist of the description really is to describe what you're going to be doing, what's taking place in this message product. Here, as you can see, the scene will end with him texting his friend back saying, not worth it, maybe next time. And as we talked about, he was going to be going to a party. And the bold statement here that they want really their community to know about or to hear is saying los sacrificios de hoy son para estar todos juntos mañana. The sacrifices of today are to all be together tomorrow. So this is part of the PSA that they want the community to know about. And as well as there being a description, you will have to include a script. And this is just an example of what a script will look like. But just in terms of time, we'll just move forward with the PSA form or with the PIF form. So going forward with this product information form, we will discuss within more detail what these PS or message products will include. All products, just as a brief overview, must include the following on them, whether that's in a brochure, in a flyer. Please note that we must include the PODER and SALUD website information, both logos of PODER and SALUD and the National Youth Leadership Council, as well as a CDC funding acknowledgement statement. This will be provided for you guys as an example to see what it looks like, whether it's on a flyer, on a video. And as we know, these message products or those that you developed with your PIF form must be pilot tested and approved through the CDC, so you can have further moving forward, so you can go ahead and continue on with your PODER and SALUD project. All right, next slide. And as mentioned by Julie from earlier on, some elements that you must incorporate within your message product. With this part of the form that you will be making, there has to be a clear objective. So you have to know what you're targeting, who you're targeting, whether that's vaccination amongst athletes in your high school or simply your group of Latino students that want to work with the organization around them. Keep your objective clear, but also make sure in the information you're providing with these message products, there must be credible sources that you guys will have access to as well. And as mentioned, these message products are required to be in Spanish, and they will be also in English, but we will talk a little bit more about this going forward in terms of providing you guys a resource with why that will be. All right, next slide. And just to finish off here, so getting approval for your message product. So you will use the product information form or PIF Word doc that will be provided for you guys. One form per message product is required unless a series with the same objective is done, such as a podcast series. But this is so you can really fit all of the information you provide in each message product. So if you make a flyer, or if you want to focus on doing messaging around the fear of COVID-19 in schools, you can do that, but we must submit one form per message product just to make sure you guys are aware of that, and that will be to get approval from the CDC to then have your guys's message products good to go. And then we can go ahead and jump on to the next slide. And some information needed with the approval, just touching base fairly quickly, you will have to have an intended audience, the type of message product that you will be creating. The objective must be clear, as well as there must be a detailed description or outline of the proposed message product. So as you guys saw in that example, Brenda and Stephanie created a PSA that gave a brief description, but that must be detailed and well outlined in order to have the message product approved. Then you will have the product piloting that will take place shortly after, and also you will include the list of sources used to fully be approved in this. And that is what the PIF form or the product information form will be about. And some resources as needed. Feel free for all of you with the copy of today's training that you'll have access to. There will be some community-based organization resources, as well as some other reliable health information sites for you to view. All right, next slide. So we have mentioned a lot of things here. I know there's a lot of information, but I just want to say this is going to be a time for you to ask any questions. And Julie, if you want to go ahead and jump in, if anyone has any questions, Julie, myself, or Pam or Carmen are here to help you answer anything you might be confused about, or feel free to email me after today's training as well.
We will be providing some more information, accurate COVID information. So remember when we were talking about some of those myths, we will be giving you some information that will help you with your message product and also help you know how to support your community. I see there's a chat. If people are already vaccinated, are they still encouraged to wear a mask? Lizzie, what are they saying at the CDC?
So if people are already vaccinated, they are still encouraged to wear a mask. The reason being is, as we know, COVID-19 is a virus that is very, in this case, it's a strong virus. But with that being said, being vaccinated will not stop someone or will not prevent that individual from still receiving or from still having a positive case of COVID-19. So it is recommended even for those that are vaccinated to still wear a mask because as we know, vaccines are a part of moving away from more people getting it, but the virus itself will still be around. Even if you are vaccinated, you still have a possibility of capturing or getting the virus and spreading it to other people.
Absolutely. Thank you, Lizzie. I think what we're going to do in the interest of time, I'm going to move ahead and ask Pam to jump on and talk a little bit about opportunities and a few announcements. Carmen's got some information to give to you for the young people to be connected, and then we're going to do a final reflection. Pam, can you jump on for a quick beat?
I will, but I think in the interest of time, I'll just let you know to watch your email this month. You've just heard a whole lot tonight about what you're going to be doing in February, so this is not anything very heavy to worry about, but we will be asking you about your interest and availability in attending the National Service Learning Conference virtual day, and we can have 1 to 2 teams attend in person. So we'd like to know who would be interested, and then we'll select from that group. And then just a really quick fun thing, if you could move to the next slide there. We wanted to let you know that in the next few weeks, I don't know if it'll be in February or in March, but we will be getting some goodies out to you all. So you have this to look forward to. We have some t-shirts coming to us from the PODER and SALUD project and some other good things. But if you can go to the next one, I'll just maybe move forward into whoops, that's the help screen, but I was just going to go into the recap. If you can keep going, I think these might be a little out of order. There we go. I was just going to offer a quick summary because there was a lot tonight that was presented. And so just to remind everybody for this month, if you're still working on your community inquiry process and have, some folks have talked to us about an extension, so keep going on that. Let Lizzie know your timing and questions so that we can help you get that part completed. And then you can go ahead and start your planning for your project this month. You heard Julie talking about that. We do have our resources on the group site, including a little bit of a planning document and a budget form. You will have a copy of these slides that give you examples of what you can use your budget grant amount for. And then by the end of this month, we're hoping that everybody could plan out one message product and submit on the product information form that Julie mentioned and that Lizzie went over in detail. And then, of course, we have our help options as needed for whatever your specific team would need. So I'm going to send it back to Julie or Lizzie, whoever is next here.
Actually, it's Carmen. Carmen, tell us a little bit about this slide.
Yes. Okay, so very quickly. Ooh, I will not go around this. We are going to start a GroupMe. So GroupMe is an app you can get on your phone, and basically it'll create a group chat. The reason we're doing this will be, it'll be group chat basically for all the young people on this call who are working on this project. So we can talk, ask questions, catch each other up. Basically just a space for us to talk and get to know one another, because this is kind of a unique situation. Like, we're from all over the country working on similar projects, and I think that's really exciting. So I'm going to drop the link in the chat. So if you're a young person and you're on your phone, you can click on that, download the app, and join the GroupMe. You can also do it from your computer, whatever device you're on. If not, you can scan that QR code with the photograph app on your phone, and you can get it. If none of that made sense to you, we can send out more information about the GroupMe to the adults, to the young people, so that we can get as many of us in this group chat as possible. And it'll be casual. I think it'll be fun. We'll just be talking, hanging out. Adults, if you want a group chat, please make one. So someone just joined the group. That was what that notification was. But yeah, group chats are fun for everyone. This is just one so that we can have a youth community around this project. Questions, comments? Is that clear? Like, if you click that link or use that QR code, you'll get the app and then join the group. Any questions about that? No.
One of, if you're having trouble accessing it either through the chat or through the QR code, drop your phone number and Carmen will send you a link. Again, thank you, Carmen, for leading that charge. I think this is an important effort for our young people to be able to connect with each other. I really appreciate that. I really appreciate you taking the lead. There's been a lot of information. Let me reassure you that we will get you accurate information about COVID. There's been some conversation in the chat that we want to make sure and address. We'll do that via the information we send to you. We will be having a coaching session on February 10 if you want to pop in. Some of you did during the last coaching sessions, and we really appreciated that because it was an opportunity for us to get to know you a little bit, but also hear what some of the cool things you're doing and also answer any questions. I wanted to ask you, we're big into reflection, and I know that we gave you so much information. So I'm going to ask you, everybody, to open up your screen or open up your chat box. When everybody open the chat box, I want you to answer this question. What is the messaging product you think you're going to create? You've heard, we've seen some ideas, you've seen some YouTubes, you've probably gone online to the PODER site and saw some products, some messaging products. What are some of the, what's a messaging product that you want to work on? A video, Victor's wanting to do a video. What else? Arlene is going to work on a flyer, a poster, a music video. Okay, you know, I love that. Using some skills and talents, some interests that you might have. A book. Victor, you're going to be busy making posters, a PSA or a flyer. Those are awesome. Maybe a poster. Okay. A zine, an infographic, an app. Luis, that would be awesome. An app would be awesome. A film, yard signs, flyers, and videos. Oh, right, Natalie, that's fabulous. Poster, Osvaldo, yeah. Short TikTok videos. Absolutely. I went on TikTok today trying to find a little snippet, and there's a lot of videos out there, a lot of TikTok videos that make people smile, that make people think. think about what kind of emotion are you trying to elicit in your messaging product? Oh, and one last thing, I'm going to ask everybody, if you would please, we need a photo to demonstrate that we have, that we're all together. So I'm going to ask everybody, comb your hair, straighten it, get good lighting, unblock your video, turn your video on, please. All right, thank you. Thank you. We're going to take a video. We're going to take a quick shot.
All right. If you guys are ready. Okay, big smiles. This will be seen by our co-partners, Proceed, as well as the CDC and other organizations. So I'm going to count to 3 twice so we can get both pages. Ready? 3, 2, 1. All right, one more time. 3, 2, 1. Big smiles. And we're all set. Thank you guys. You all looked amazing.
And Pam is reminding us, if you haven't signed in, please do so. The link is in the chat. Lots of information. If you have some other questions, we're going to hang on for a few more minutes. Honor and privilege to be with you all right now, and work to be done and important messages to get out. Thank you, everyone, for being with us today.
Thank you
Have
so
a great
much.
evening.
A great day.
Thank you.
De nada.
Thank you.